been personally affected by lack of ability to afford health care. And then you're going to listen. Some people will have stories and some people won't. I know, like, we canvassed a few weeks ago in Grand Oaks, and most of the people in that neighborhood have really good health insurance. A lot of them, I think, are university professors, or they work in for companies that provide them with health insurance. And so the response was often, "I'm good. Yeah, no, I haven't had any problem with getting the health care I need." And then you might ask them, well, do you know anybody that's ever had problems? And sometimes they do, and sometimes they don't. And so you're really listening to their response. And at that point, if they tell you something, again, that gives you some little clues, tell me more, tell me what happened, how did you feel about that? At that point, if you have the opportunity, you're going to share what a story that you have about healthcare, or maybe your personal experience that's really made you decide this is an important issue for you. For example, right now in my family, I have a brother-in-law that has cystic fibrosis. He has been a nurse here in this area for Samaritan, working the last 8 years, and he got to the point last year where he was hospitalized twice for multiple weeks. He finally had to quit working. And so for their family now, it's been pretty devastating. They can't afford their house. They're in process of getting ready to move to sell their house because they can't afford it. The worst part about it is that at the time that he needs his health insurance the most, he's lost his job and no longer has health insurance. And there's some special medications he needs that my sister works for the school district. He can't get the medications he needs. Either his old insurance from Samaritan or his insurance now that he's getting through the school district will cover the medication he needs for his condition. So the stories are important to tell people about, and it sounds like there's somebody in this neighborhood recently who has passed away. And I don't know the details, but it would be interesting to get the details of that, and that could be a pretty compelling story to tell people in this neighborhood. You know, we have a neighbor down the street that recently passed away. It sounds like nobody even knew that he had died.
Yeah, it was just kind of a few days of the newspapers piling up. I decided to call the police for a police job.
Yeah, I mean, I don't know what all the stories are, but since so many of you are new, one thing that we didn't do that I usually do is we introduce ourselves and tell a story. So I'd still like to actually do that in a second, but I'm going to go through and just finish the script since we started it. So you're going to share your story, and again, you're not going to talk for 10 minutes. You're going to share a story in about a minute. And then we're going to tell what's happening, because that's another important piece of this. We're trying to educate people about what's going on federally and at the state level. If you don't know, don't make it up. It's okay. You can just say, we've recently passed in Oregon Senate Bill 770. And at that point, you can pull out your packet and say you can read about that here. It establishes a task force to look at creating a system of universal health care in the state of Oregon. So you can show them this and tell them there's more information in the packet. You can also, if you know more about what's going on nationally, point out that there's legislation at the federal level, the Medicare for All Act. There's also legislation in the House, and we'd also like you, if it's something you support, to contact your representatives. There's another page in this packet that, again, you don't have to make up. You can. The sheet tells people exactly what they can say. Thank their legislators, and ask them if they will support these bills. And so this also has the bills, the numbers, so you don't have to remember that. I think the most important thing, which again my mom reminds me of, because I'm so worried about the technique, is that we're connecting with people. We're connecting with people on a personal level. We're connecting with our neighbors and letting them know that we believe this is a human rights issue. This isn't a political issue. This is about making sure that everybody can, in a nation as wealthy as ours, there's enough money in the system to pay for everybody to get the health care they need. And to let them know you believe that and why you believe that. Some people might respond with, I'll just share, and maybe Mike, you might share also some of the responses we've gotten. Some responses are, I've got all the health care I need. But then they're thoughtful when you tell your story about somebody you know. And they might say, that's something I'd be interested in. I don't want to be on any email list, but sure, I'll take your paperwork and take a look at it. People who really don't know, but don't want to get on an email list might do that. One thing you can say is, if you're interested in just signing our statement of support, you don't need to leave your phone number or your email. This is something that we're using to let our state legislators and our federal legislators know that people support this. So if you don't want to get on our email list, that's fine. You can still sign our statement of support. So that's what this is at the top of the page.
So what's the minimum they can put down there? Can we?
I think they can just put their name.
Their name.
And their zip code.
And
The
their
name and their zip code that tells what part of the state they live in. Some other responses I've gotten are, I don't believe in that.
So he got it directly from, Anson to no socialized medicine.
Right.
And that we just said, we just don't want to see people getting sick and dying and because they're not insured or underinsured. That's our whole purpose.
Yeah.
That's all we care about.
Yeah.
And that
And one of the responses I've given, because I had a man say that to me a couple of years ago at the fairground. He was really about, you people, you just don't get it. Why do you want to have socialized medicine? And I said, I don't know what you mean by that, and which was true. I just said, I'm really not sure what you mean by that, because this is really about other Americans who are getting sick and can't afford the health care they need. So I don't, and when I said I don't know what you mean by that, I think, can you explain what you mean by that? I don't think he knew what he meant by it either. Right. So again, it's kind of just that being human and being honest, that because I was really listening to him, but I didn't know what he meant by socialized medicine. And I think we ended up having a conversation about our values. It was a very long conversation, and I told him about my family experience growing up. My dad was career military. We were raised Catholic, which most people think are pretty conservative. And so when I said, I don't really know what you mean by that, I think he ended up taking our literature and sounding like he would at least read it and consider